Yesterday also I went to the trauma triage of my hospital. The two people were crying very badly because they lost their relative, and I could not see that thing, and I was also crying from inside of my heart. Being a doctor, I am feeling helpless seriously because I cannot save our country, and I am not able to save country because resources are limited. Please help us. We are seriously helpless. We want to save our public. We cannot see our people dying.
We're at the cusp of the worst crisis that this country has ever faced. Every day, we see record-breaking numbers of new cases and of mortalities. Inside our ICUs and wards, these numbers are humans. People with fathers, sons, mothers, anxiously waiting outside our wards, calling us, "How is our son doing?" Amidst the crippling shortage of oxygen, beds, medicines, and now even healthcare workers, witnessing a father of 2 young children succumbing to this illness all by himself, you struggle to keep your own anxieties and fears at bay. Is this how you'd want your loved ones to leave the world, struggling and gasping for breath? Every day you come back home asking yourself, is any of this even worth it? And that's when you see another set of rising numbers, with more and more number of people coming together on social media platforms, creating support systems, creating support ecosystems, procuring and making oxygen cylinders, drugs, beds available and accessible for people, reaching out for not just logistics but also emotional and mental support. So if you've been feeling lonely, if you've lost a loved one to this illness, or if you're struggling with this illness or know of anyone who's struggling with this illness, please know that you're not alone in this. We're here for you. And with grit, love, and hope, I feel that we can sail through this.
It is very painful to really see the patients dying, young and old, all are dying, and really it is causing a lot of trouble, lot of mental torture to us. Really, I want the authorities and government to really help us, and it really means to arrange all the essentials to help us in this COVID time.
On most days when I cannot do anything else for the patient, I at least try to sit at their bedside, making it a little easier for them to pass away with someone next to them. I don't know if it makes sense, but I do hope that it provides them comfort in some way. And I feel really exhausted after each and every shift, and it worries me a lot that I cannot go home back to my parents because I might be taking home the infection to them.
I'm Dr. Siddharth Tara, General Secretary, FIMA. I happen to be an anesthesiologist and a critical care resident doctor, and the scene all around me is heartbreaking. There is death everywhere. We're trying our best, but that's not enough. Far from enough. When citizens pay taxes and they cast their votes every election, they expect a functioning state machinery. The patients and the doctors treating them, we both feel the system has abandoned us. We request everybody to stay home, stay put, stay safe. Many resident doctors are turning positive at an alarming rate, and I fear there will be enough of us left to fill in the ranks 2 or 3 months down the line. That's why, even though I am at high risk, many doctors like me, we are volunteering to work. We will not abandon.
Today, the world around us is filled with grief. News of lack of oxygen, lack of beds, lack of medications, lack of a proper place to give a good funeral to your loved ones. It's tragic. Trust me, as a doctor, I'm appalled by what is going on around me, and as a citizen of the country, I'm honestly hopeless. But today, I really want you to focus on something that's very undermined these days. That's a positive mindset. A positive mindset, a calm attitude. If you turn out to be positive, if your loved one turns out to be positive, trust me, can go a long way in the recovery of a COVID-19 positive patient. I know it's easier said than done, but 90% of COVID-19 infection cases are mild, and these symptoms can be treated at home, isolating the patient, and of course in consultation with a doctor via telephone, WhatsApp, video, anything. And I am with you in this battle, and we all are fighting a war, and we are all a part of it. Please don't feel alone.